Our moderator for this session is Lady Rosalind Marauta, Chair of the Board Global Fund, and also former First Lady of Papua New Guinea. Lady Rosalind is a prominent figure in the global health governance space. She brings extensive experience from her tenure as the former First Lady. Her leadership at the Global Fund involves overseeing strategic initiatives to combat diseases including malaria, leveraging her profound understanding of health systems and international development. I'd like to invite our panel members and our moderator up on stage. And we will first hear some brief remarks from Dr. Lino Tom before we hear from our keynote speaker.
Afternoon again. Thank you, Mistress of Ceremony. Good afternoon. I hope you all enjoyed your lunch today. Let me start by acknowledging the distinguished representatives on this panel today. Lady Ross, who will be our chair this afternoon. Honourable Minister for Health and for Solomon Islands, Honourable Minister of Health for Timor-Leste, the Director General Ministry of Health, Vanuatu, and of course the Director of CDC Indonesia. Thank you for taking the time to come to Papua New Guinea to share your country's experience in eliminating malaria. Malaria is among the top 10 causes of death in Papua New Guinea, and as I mentioned in my opening remark today, it is a significant public health threat which affects our most vulnerable populations. In endemic areas, it is the most frequent outpatient diagnosis and the second leading cause of admission to our health facilities. There are only 6 years remaining to reach our 2030 goal of achieving malaria elimination in our region, and as such, we need to accelerate our collective efforts. To strengthen regional collaboration, we aim to reaffirm our high-level commitment through the eliminating malaria and other vector-borne diseases through enhanced regional partnership initiative. I look forward to hearing from my colleagues on the success stories and the ongoing challenges in eliminating malaria in their own countries. Thank you all.
Today we're privileged to hear a keynote address from Dr. Rattanaxay Phetsouvanh, Vice Chair, Regional Artemisinin Resistance Initiative Regional Steering Committee and Director General, Department of Communicable Disease Control, Ministry of Health in Lao PDR. This presentation will really present the learnings from the Greater Mekong Sub-Region, and we look forward to hearing these learnings as we sort of think about the context here in Papua New Guinea, Melanesia. Dr. Rattanaxay graduated from Leipzig University in Germany and obtained a Doctor of Medicine from the same university. He holds a Master of Science in Tropical Medicine from Mahidol University in Thailand. He has served as Chair of APMEN, Surveillance and Response Working Group, and also a visiting lecturer. Thank you so much, Dr. Rattanaxay.
His Excellency Dr. Lino Tom, Minister of Health of Papua New Guinea, His Excellencies Ministers and the Secretary of Health from inviting countries, Ambassadors, Madam Lady Rosalind Marauta, Global Fund Board Chairs, Regional Director of WHO's, APMA CEO, distinguished guests, ladies and gentlemen. First of all, on behalf of the RISE Steering Committees, I would like to express our sincere thanks to the government of Papua New Guinea and APMA for inviting the RISE Regional Steering Committee to share the RISE project with its lesson learned, best practice, including challenge at these very high level meetings. Can I have the slide, please? As you know that the Regional Artemisinin Resistance Initiative have covered or is covering 5 countries. Yunnan province from China, Myanmar, Thailand, Laos at the centers, Vietnam and Cambodia. As you know that when artemisinin resistance Plasmodium falciparum emerged in the Greater Mekong Sub-Regions, an urgent and coordinated response was urgently needed. In 2014, the Global Fund launched the Regional Artemisinin Resistance Initiative, or in short, RAI, to address this threat, which pose a danger to high burden area elsewhere in the world if we don't do anything. And it has since invested more than $7 million. So I would like to share with you what are the key success of the RAI projects. Under the RAI project, we have 2 key elements. The first one is a regional approach, where we bring together governments, health practitioners and policymakers, scientists, development partners, and private sectors, including civil societies and communities, together to eliminate malaria. And of course, we have a very important element or component that it is based on community-level networks, which we have more than 35,000 malaria workers working in these 5 countries. They are the ones who provide the malaria services to remote areas, including the marginalized populations. I think they are the ones who know better malaria than we on here, experts sitting around here in these rooms. Next, I would like to say something about the regional approach. The regional approach is aimed to eliminate Plasmodium falciparum in these regions. It has been identified as the only strategies to sustainably address the threat of artemisinin resistance. The GMS government set the targets of limiting P. falciparum by 2025 and all human malaria species by 2030. High-level political buy-in is very essential for eliminations. The regional steering committees, we provide strategic directions for investments in malaria eliminations in the GMS, serving as a forum for coordinations, cooperation and accountabilities, and working, of course, very closely with the country coordinating mechanism or country CCMs. We bring together a coalition of the Ministry of Health among the 5 GMS countries, the national malaria control programs. Some of them are attending these high-level meetings here. We also have representatives from countries bordering the GMS, not only the 5 countries. We also, for example, invited countries like India, Bangladesh, and others to join during our annual meetings. And of course, researchers, civil society representatives, multilateral organizations, development partners, private sectors, and UN agencies. Next slide, you will see these are the main components under the regionals. So there are 6. The first one is eliminations focused on service deliveries in border areas. What that you see here, we have a problem raised, especially along the Thai-Myanmar borders. And then we have a technical and coordination support for program qualities and community engagement. The third one is malaria and resistance surveillance that have been under WHO and some teaching institutions or research institutions here in this region and also elsewhere in the world. Another fourth is certification and prevention of re-establishment. Some countries in this region have already reached almost the last mile of malaria elimination. So it's very important to carry out the certifications and prevention of reintroductions. And of course, the fifth one is governance, strategic monitoring and management. How to convince donors and governments, community to reach the last mile, which is the most difficult stage. And of course, we also do testing, sharing, and tailoring of innovative or outcome from operational research to all the countries as well as in this region. The next slide, you will see what are the progress under the RIE from 2014 to 2023. You see that many subnational areas that you can see on the map, they already reduced the malaria burden drastically. Even some have also reached the zero, almost the zero level. And next slide, please. You will see that among the GMS countries, each country have at least 2 artemisinin-based combination therapies with more than 90% efficacy. Next slide, please. And of course, what are the situation on malaria case? You see that the P-falciparum have been drastically reduced, and 4 GMS countries reported fewer than 500 cases in 2023. I think Vietnam, Laos, Cambodia are very near to eliminations. But despite this progress, we still have challenge to overcome. Next slide, please. We have the case of P5X. Despite P5X case have decreased drastically in 2020, but it have rebounded, driven by the rise of in the Western GMS countries. And what are the others remaining challenges? Next slide, please. Of course, we still faced with increasing constrained state of malaria case in dense forests, especially among the migrant mobile populations, and in very remote border areas, especially along the Thai-Myanmar borders in conflict areas where the access is very difficult. So what's next in the coming years? Next slide, please. I think it's the last slide. Elimination needs to be completed. We all agree. And re-establishments prevented again a backdrop of increasing country ownership, increasing domestic fundings, and a reduction in international donor funding. This is the new challenge that we all countries have to face, even though we are very near for malaria eliminations. Malaria service need to be integrated into a health system more fully. We cannot keep the silos standing alone. We need to integrate it. And we have to use the 35,000 strong community malaria workers. I think that they have very good experience, expertise in the community. We can use them by incorporating all the services like maternal, vaccination, and others. The GMS have a lot of lessons learned, and we have faced varied malaria burdens, such as problem of drug resistance and the specific challenge, including how we are going to do the transition periods and how we are going to reach the last mile. But I strongly believe that the global funds, as well as all the international donors, including developed partners and the ICs and governments from the 5 GMS, will continue to support to reach these milestones. And I strongly believe that the communities within the GMS as well as outside will provide us strong advocacy and support. So I wish this high-level meeting a very fruitful deliberation. Thank you very much.
Thank you so much for the address, Dr. Rattanaxay, and from sharing these learnings from the Greater Mekong region. I will now pass it on to Lady Murata to initiate our discussion on strengthening regional collaboration. Thank you.
Thank you very much. The Rai story is a very good one, but it's taken a lot of money, as you saw, $700 million. It's been a huge investment by the countries of the region, of the Mekong, and the Global Fund. And as Dr. Rattanaxay said, it's so important that we not give up, even in the midst of possibly reducing resources. But we're not there yet, even though we've made such enormous strides. There are so many lessons to learn from the Rai that we can apply to other countries in the region. So we all know that eliminating malaria is a goal for all of us for 2030. Whether we're going to reach it or not is another question. With limited resources and competing priorities, last mile efforts often take a back seat. Malaria itself often takes a back seat. So ministers, in your opinion, how can integrated approaches support the acceleration of disease elimination efforts in your country? Dr. Lino, we'll start with you.
Thank you, Lady Ross. PNG has already seen some early success from taking an integrated approach for other diseases. For example, combining mass drug administration for treatment of both lymphatic filariasis and yaws resulted in 100% coverage compared to 51% coverage when patients were only administered treatment for a single disease. With over 90% of our population living in rural areas and a constrained health force, we need to make more efficiently and effectively we need to work more efficiently and effectively within our constrained and limited resources, not just in malaria prevention and control, but for broader disease elimination efforts. We need to move away from disease-focused model. I encourage health partners to support our ongoing efforts to take an integrated disease approach through both funding streams and technical support. We also need to integrate malaria prevention and control into primary healthcare services. A coordinated approach will mitigate duplication of initiatives and resources, but also enable sharing of new tools to achieve better health outcomes for our population. Today we've had a very important question being asked about socioeconomic determinants of health, and I bet it plays a very, very important role in our efforts to eliminate malaria in this country, because most of the constraints that we face in reaching out to our people are basically socioeconomic determinants of health, and I think it needs a concerted and an integrated approach, not just within the health system, but from the greater government mechanism. Thank you.
Thank you very much. We look forward to that day of integrated services. Ministers outlined very clearly how we would like to do things. Dr. Phetsouvanh, do you have something different to add from what Minister Tom has said?
Thank you, Lady Rose. Before I make any comments, I would like to take this opportunity to thank the PNG government for having us, the Solomon Islands here, Solomon Islands delegates, on behalf of my government and the people of Solomon Island Minister of Health, pass our sincere greetings to the government of PNG and the people of PNG. And also thank you as well, the Apolma, for having us here. My question is, first, we need to define the integrated approach, which focused more on the vector control, and the vector control plus the epidemiology of the mosquito parasite, and then looking into the human behavior. And when we look into this three complex issue, then we try to address this by launching our roadmap in 2018 to focus mainly on eliminating malaria by 2030. This roadmap is an inclusive one to which we involve the whole government, as well as involve the societies around Solomon Islands. But we also want to make this roadmap integrated into the educational system, to which our children should learn the concept of malaria eradication in schools. And as well as when we want to address development, that focusing in the rural development, we must ensure that we factor the elimination programs of malaria as well. And not only that, but we also try to encourage the private sector, to which I came from a private sector point of view. I was working with New Britain Palm Oil, and then one of the branches in Solomon Islands, to which we actually calculated the lost time due to malaria, and then we craft a policy to which we address malaria. And we also initiate like a Go Green Day, to which we actually do cleaning up every Fridays and every after 2 weeks. And then we have seen that the incidence of malaria dropped from 35 to 1 per month. And I think that is what is the part of our roadmap to eliminate malaria by 2030. Thank you.
Thank you, Minister. And Minister Amaral, Timor-Leste has done much better than Papua New Guinea or Solomons in terms of getting very close to elimination. So what have you used integrated approaches to health service delivery to achieve that?
Thank you for highlighting the crucial goal of malaria elimination for Asia-Pacific region by 2030, as aligned by SDG 3. Before I would like to detail things under the question, I would like to express my deepest solidarity for all the victims of natural disaster in Ingen, a province of PNG. As we know, Timor-Leste is a pioneer in integrating various essential primary health functions, including disease elimination, prevention in the overall primary healthcare systems. Country has showcased an excellent example of integrated neglected tropical disease surveys, lymphatic filariasis, transmission assessment survey with screening of skin disease, including yaws and scabies, stool examination for soils transmitted helminthiasis and taniasis, assessment of WASH indicator or worldwide, nationwide. All morbidity management and disability prevention can associated with the lymphatic filariasis integrated in the primary healthcare. Means neglected tropical disease, as we know, generally affect people who are underserved, marginalized, and lacking access to basic services as a wash, sanitary, and hygiene. All three essential basic services aligned with the primary healthcare system. The 2020 external review advised the establishment of the Integrated Vector-Borne Disease Control, IVBDC, program under the Disease Control Department by integrating the National Malaria Program Vector Control, entomology activity with other borne disease. Since the country has achieved significant reduction of malaria and making efforts to maintain the malaria-free status, based in the current NSP 2021-2025 and Integrated Vector-Borne Disease Control Strategy 2021-2030, the country has planned of transition malaria program to the Integrated Vector-Borne Disease Program, focusing on controlling to the mosquito-borne disease as a dengue and chikungunya are the still major public health concern in the country. The integrated case-based surveillance, ICBS Timor-Leste, for TB, HIV is a DHIS, Digital Health System Integrated Based Electronic Case for surveillance initiatives that capture individual-level data from the mobile application at the grassroots level is another case point to support the accelerated of disease elimination effort to achieving better health outcomes in the population. One of its notable features of ICBS Timor-Leste is a streamlined and current malaria for collection module, supporting both individual case details and aggregate malaria data. Within the individual malaria data module, ICBS Timor-Leste is a conduct case-based surveillance of malaria-infected individual and investigated malaria foci. The integrated system incorporates DHA's 2 even data modules offering comprehensive insight into preventive measures like BSI, IRS, and RRIN. The aggregate data modules cover diverse aspects such as LLIN, distribution laboratory equipment, stock for malaria. The government of Timor-Leste is committed to strengthening health system and drive it towards achieve universal health coverage through equitable access, quality health services that are integrated, safe, people-centered, and cover a range of components maintain continuum of care throughout of life course of individual. Toward this endeavor, I, as a Minister of Health, along with the WHO representative, have recently launched the policy of integrated health services. It's called PEACE, the five-fold integrated model for ensuring that Timorese receive appropriate care, delivery in the right manner, and the right individual close to their home. Lastly, integrated approach fosters community engagement and ownership. By involving community in the design, implementation, and monitoring of intervention, we can build trust, empower individuals, mobilize local resources. This bottom-up approach not only strengthens the resilience of community, but also ensures that sustainability of intervention beyond external support. In conclusion, integrated approaches offer a promising pathway to accelerated malaria elimination effort and achieve better health services. Collaboration, innovation, and community participation, we can overcome the challenges of limited research and competing priority and ultimately realize our shared vision of malaria-free future. Thank you for your kind attention.
Minister, we clearly have so much to learn from your new country. I sometimes wonder, when you look at the fabulous success of Timor-Leste, is it something to do about newly independent, that the ambition is there, the desire to do well is there? In countries like ours, where we've had independence much longer, we've lost some of that. Another country that's doing well, Vanuatu. Dr. Tapo, what can you share with us about the value of integrated services in terms of malaria elimination?
Thank you, Lady Rosalyn. I think firstly, I just, on behalf of my government and my Honourable Minister, I just wanted to say thank you to the PNG government to invite your small brother Vanuatu to attend this very important summit. We also, on behalf of the government, extend our condolence to our people in Wabe for the landslide that happened recently. I also want to acknowledge the governor for Oro Province, Gary Trufa, that just walked in. We also acknowledge him with all the diplomatic corps and dignitaries that are amongst us. So for Vanuatu, integration has worked very well for us in terms of neglected tropical diseases. We managed to eliminate lymphatic filariasis, trachoma just recently. We are trying to also use the same approach to address malaria. I think it comes back to how we integrate the programs, the public health programs, with the provincial structure. And I think that's one of the areas that our government has developed a decentralization policy where how do we actually involve the provinces, the area councillors, the KIAPs, for them to assist healthcare officers to deliver services, especially for the malaria elimination strategy that we have in the country. I think that's one of the areas that we wanted to more emphasize. Secondly, in terms of the vertical programs that some of our partners provide, governments is emphasizing on integration, but the partners are more vertical. They want TB or they want malaria. And some of the programs, they also have an impact on other diseases as well. So how do we actually voice that concern to partners to making sure that they also understand the concept of government for integration and they support integration at the national and the provincial level as well. For our people, the mentality of integration is something that we are always trying to advocate at that level, to also give them be part of integration. And I think a few challenges that we are facing, currently our teams are out in the field also trying to address malaria in the northern part. We managed to eliminate malaria in the southern part of Vanuatu, in Tana, if you've been to Vanuatu. So we are trying to focus especially in terms of what does the community want in terms of rolling out, for example, Primoquine. 14 days for a community to roll out Primoquine is tough in terms of compliance. So whether it's another concept, whether we do 7 days, and I know there's much researchers in here, Bana Institute is also assisting Vanuatu and other partners in terms to finding out a solution on how we really address that behavior change in for patients or our people to be compliant with 14 days of rolling out Primoquine, because the dominant vector in our country is Vivex, not Falciparum. Falciparum is gone, so we only have Vivex. So I think Lady Rose will now take this step.
Thank you very much, Dr. Taupo. And Indonesia, I guess, is a bit of a mixed bag. You were telling us over lunch that, in fact, malaria has been eliminated in the majority of districts in Indonesia, but still with a very big burden in Papua and in Kalimantan.
Kalimantan also East Nusa Tenggara.
Yes.
Border with.
So perhaps you could tell the audience what's been a measure of the success in the areas where you have eliminated malaria, and what's lying in front of you, and in terms of integration, what Indonesia is doing.
Yeah, thank you, Lady Rosalind, for the opportunity to explain Indonesia achievement. Yeah, so Indonesia is a big country. We have more than 17,000 islands, so it's a very big country. And among 17,000 islands, 14,000 inhabited. So we have various of the problems in health and also health achievement. So about the malaria, what we talking in the lunch. So among 514 districts in Indonesia, we still have malaria problem in around 135 districts. And most of them are in the eastern part, in the Papua, East Nusa Tenggara, border with PNG and also border with Timor-Leste, and also one district that will become our capital in Kalimantan. So if the percentage is only 2%, Lady Rosalind, about the population that infected to malaria. And we also feel that integrated approach is very important for how to leverage existing health infrastructure and also resources to address multiple health challenges simultaneously. So by integrating malaria elimination effort with existing health programs such as maternal and child health, immunization, and primary care services, we can maximize the impact of resources. This ensures that effort to combat malaria do not undermine other essential health interventions, but rather complement and strengthen them. Integrated approach facilitate collaboration and coordination among various stakeholders, including government agencies, non-governmental organizations, community-based organization, international partners. And by fostering partnership and sharing expertise, resources, and best practices, countries can pool their effort to tackle malaria comprehensively. This collaborative approach enables more effective and sustainable solution for malaria elimination. And also I want to highlight that some effort that we already did should be complemented with data-driven decision-making and innovation. Because utilizing technology and research to inform strategies and interventions. By leveraging data analytics, countries can target resource effectively. And we can also identify high-risk areas and also monitor progress toward malaria elimination. So Indonesia also have collaboration with University of Muhammad bin Zayed in Emirat Arab. We have collaboration to make artificial intelligence with them to make a display and to what we call to forecasting which area that will be outbreak of malaria and also dengue. So I think this is the technology that we can also explore, Leaders and the other countries, that in the future it will be more important. Thank you.
Thank you. So, as we've heard, 2 countries in the region that are doing very well, well, more than 2 countries, but here on the panel, Timor-Leste and Vanuatu. Indonesia, PNG, and Solomon's further behind on the elimination trajectory. So, for those further behind, what do you see as the major challenges in getting to elimination? Dr. Phetsouvanh, let's start with you.
Thank you. The key challenge is, first, traditionally we are doing the centralized in terms of managing our program. And so we want to rebalance the decentralization and more on balancing the integrated approach and as well as the vertical approach. One of the challenges that we noted is in the past, if you see our historical data on the 2023, we have declined in terms of our annual parasitic incidents. It decreases from 200 to 30, but then it spikes again. One of the things in which we see is to address the human parasite burden that we currently have. And so addressing the human parasite is more on a clinical approach. So in Solomon Islands, there are a number of factors that is affecting the clinical practices. Number one is if we are diagnosing PF, for instance, you need to start those with the primaquine. But non-availability of a primaquine in the rural areas could be another challenge. So instead of starting primaquine plus Coartem, the clinicians would just do the Coartem, and then because of non-availability of the primaquine, and then we don't we don't really apply the standards that is being stated in the WHO guideline. Secondly, for the PV, malaria, you need to do G6PD test, which the testings, it's also not available across Solomon Islands. So nowadays, patients or people having access to information, they would just Google the side effects of primaquine and said it's hemolysis, and they will raise another issue of patients' compliance to the medication. So the key challenge is the resources. We need to step up with our clinical resources and as well as train our malaria workers on how to do early diagnosis and as well as early treatment. One of the challenges is to invest into the civilian system that will enable us to have more quick information and then that will be subsequently gives us a good targeting interventions in eradicating malaria. We are also reviewing some of our health service resources to ensure that we have the right people in the right place doing the right job. Like today, it's fascinating to learn the new approach is the vaccination. We need to update ourselves on the new drugs availability, and also that help us to fast track some of our research knowledge. One of the challenges I think all of us here would be able to know, in an environment where reducing budgets took place, and with the increasing cost, we cannot implement everything that we want to do. We note that there appears to be the perception that Global Fund own the malaria financing space. We would encourage other partners as well to engage with us to identify areas of mutual interest to invest in the malaria elimination agenda, to which that is our ultimate agenda, why we were here and why are we here today. Thank you.
Thank you, Minister. I wouldn't say that Global Fund owns the malaria space, but the fact is we do provide more than 2/3 of international financing for malaria throughout the world. Minister Tom, what do you see as the major challenges for us to get to elimination?
Thank you, Lady Rose, and let me also acknowledge our good governor, Honorable Gary Jufa, for attending this session this afternoon. Therein lies one of the biggest problems for health in this country, where the political attention is not there when it comes to health. I think it's not a peculiar problem for this country. I think it's the same problem elsewhere globally. But coming to issues surrounding elimination of malaria, recently we've had COVID, and COVID has actually exposed us to the fragility of our health systems, where our systems are quite vulnerable to the impacts of COVID. And from that experience, we've realized that our health systems, basically in terms of the infrastructure and in terms of human resource, is one thing that is quite lacking in this country. We have a growing population with a growth rate of nearly 3%, and a budget that's not keeping up with that growth. So basically, if you look at the issues of malaria elimination in our country, we have a very fragile health system, supply chain issues and limited access to health systems and services in this country. Access is one of the biggest problems we have for early diagnosis and treatment of malaria. We have communities that are quite hard to reach because of the difficult geography in this country, quite rugged terrain, and so access to remote communities are quite difficult. The compounding effects of climate change. The borders, geographical boundaries of malaria have actually extended in this country. With climate change, the place is becoming warmer, and the disease is actually spreading further into colder climate areas in this country. We have limited sustainable financing and human resource. Integrating malaria control into a broader vector-borne disease program is another problem we have, and we should be addressing. Adequate distribution, efficacy, and use of insecticide-treated bed nets. Supporting and educating at-risk groups like pregnant women and young children is another challenge we face. Engaging communities effectively and providing culturally appropriate education and health promotion on malaria prevention and control. Addressing any concerns and other common misconceptions. Now, the health plan that we have in this country prescribes certain strategies to address these problems that we have in this country, and I'll just list a couple of them. Number one, it states that PNG's National Health Plan has laid out 3 strategic strategies to reduce the burden of communicable diseases in this country. Number one, by increasing capacities of health sector to prevent, promote, and treat the disease. to build capacity of provincial health authorities, to improve disease surveillance, and number 3, raising awareness amongst key stakeholders to enable collaboration and meet disease elimination targets. And as I've mentioned earlier, malaria is an health problem, and health has issues. And some of the biggest issues of health is in terms of financing and, of course, capacity, both human and infrastructure capacity. And those things can be addressed through an integrated approach from all government sectors. Thank you.
Thank you, Minister. And Minister Amaral, are there specific issues that Timor-Leste has experienced in trying to achieve the last mile? Are there specific obstacles and challenges?
Ms. Lady, Timor-Leste has made significant progress in combating malaria, rapidly advancing towards WHO certification for elimination malaria. The country continues bolstering efforts to accelerate the fight against malaria and drive towards a malaria-free for Timor-Leste. Country has been successful in interrupting indigenous transmission since 2018, and West Timor, or Indonesia, has already embarked upon malaria elimination. However, in 2020, when a small Plasmodium falciparum outbreak reported in the border dispute Naktuka village. Naktuka village of Oikusi in 2023, with 5 introduced cases recorded in Tilomar sub-municipality of Kovalima, are stark examples that may happen in areas free from malaria facing with malaria importance from neighboring country confronted with the unresolved malaria problem. Tilomar is one of the administrative posts situated in the border between Kovalima and Malacca municipality and classified as a high-level vulnerability and receptability. Therefore, comprehensive prevention and control activity have been routinely undertaken over the years, such as the distribution of the long-lasting insecticide-treated nets every 3 years, indoor residual spraying of the houses along the border every 6 months before the rainy season. Mosquito nets were distributed to risk population such as migrants, workers, security forces, and border policy who stay and live in the border. Besides this mentioned intervention, the country has stabilized strong surveillance in all the borders by placing the community health volunteer to conduct screening of the mobile migrants who are crossing the border. The national malaria teams with Kovalima municipality had conducted an assessment to all the points of entrance in Salele Suai, where population are used to crossing. Awareness program through the engagement of the community and night health education related malaria elimination and prevention of introduction case. Multi-sectoral advocacy approaches. The government Timor-Leste is will committed to support the effort needed to accelerate malaria burden reduction and moving towards a malaria-free Asia-Pacific. With just 7 years to reach the regional goal of zero malaria, there is no time for complacency. We need to redouble our effort and maintain the current strategy plan for prevention of malaria in the country and to come together as a region to eliminate malaria. We believe that all the country in Asia-Pacific region is committed to achieve the malaria elimination by 2030. Thank you so much.
And Dr. Tapo, in the case of Vanuatu, what specific obstacles have you experienced on the last mile?
Thank you, Lady Roslyn. I think most of the information in terms of infrastructure, human resource, Honorable Minister mentioned already. I think one of the things, and I'm so grateful that you're the chair and moderator today, and that's about the Global Fund funding. And I think on a practical level, we have spent, and our teams have spent a lot of time doing the administrative functions of reporting back to the Global Fund. And I think this is one of the biggest challenges that I wanted to mention. We depend more on Global Fund on the funding. We spend every quarter providing reports to the Global Fund, making sure that the financial system is in order before they start dispersing money. And I think if we can change that from quarter to a 6-monthly basis, it will assist us in terms of Vanuatu and our teams that are stationed in the provinces to respond. The other aspect of contributions that we receive from our partners stop at the national level. I don't know whether they are yet to have confidence in the provincial system or the financial management system in the province for that funding to be decentralized so that our team can access funding right at the rural remote areas through the area councils or through the province and then deploy and do the elimination as part of our strategy. So I think that is one of the main areas seem to be our challenge right now since Global Fund, and I know that you will take it on board. Thank you.
Some very practical problems. Some very practical problems. And in the case of Indonesia, you've got success in some provinces and not in others. So where you've had success, were there some specific obstacles to reaching the last mile?
Yeah. Indonesia, like I mentioned, that very big country, and we have 514 districts here. And health are also decentralized. So I think decentralization is challenge. It's also benefit for this one. So like, I mean that if the head of the district have a concern about the malaria, they will give sufficient resources, like you mentioned, Mr. Minister, about that one. However, the problem now is the district he already elimination. So they say that, oh, that malaria is not problem anymore. So how to maintain the sufficient resources for the malaria is need to be strengthened. So that's why Ministry of Health, with the Ministry of Home Affairs, giving hand in hand to how to advocate the district about the malaria in the several areas. And the second thing that I want to highlight is also what Minister from Timor-Leste also mentioned about the cross-border. So we are concerned about the cross-border malaria transmission. Indonesia also shares borders with countries where malaria remain endemic, like PNG and also Timor-Leste and also Malaysia. So this is leading to potential cross-border movement of infected individuals and malaria vectors. And we believe that strengthening cross-border collaboration and information sharing is essential for preventing the reintroduction of malaria and achieving regional elimination goals. And lastly, about the climate change that mentioned by Minister of PNG. So we have research, Lady Roslyn, for the dengue, for the mosquitoes of Aedes aegypti. So we found that when the temperature is rising from 25 degrees Celsius to 30 degrees Celsius, the mosquitoes tend to bite twice higher. So it means that in below to 25 degrees Celsius, they bite every 5 days. But when the temperatures rise up to the 30, they bite 2.5 days. So maybe that's also we have to concern about this one. So that's my response, Lady Roslyn. Thank you.
Thank you very much for raising the impact of climate on malaria. I mean, in Papua New Guinea, areas higher up where we never had malaria historically, we now have significant malaria. You can see it in front of you all the time. This time, my last question, we have to be very quick because I think we've gone over time already. We've heard from Dr. Rattanaxay about the success of regional collaboration in the effort to eliminate malaria in the Mekong. So I'm wondering, how can PNG and our neighbouring countries represented here could collaborate much more effectively to achieve this shared objective of eliminating malaria? Dr. Tom.
Thank you, Lady Ross. I think malaria presents a common problem that presents to us peculiar and similar situations and challenges. I think we have to learn from the successes of those countries who are doing really well, and I think increase the level of collaboration with them through sharing of information, innovation, and their experience. I think it's best to learn from countries that are doing well, and I think in order to do that, we have to increase the level of collaboration between the countries within our region. Thank you.
Thank you. Solomon Islands?
I would also, my answer is similar, but looking at the health system of the Melanesian region, I think we share the same structure, and it is important that the knowledge of successful initiatives in one country could be shared and readily adopted where appropriate in other countries. Also, study sites across countries could be established to answer our common research questions and challenges and provide some common solutions. One of the things as well, we should pool our technical experts together, especially studies on therapeutic efficacies, insecticide resistance studies, as well as drug quality. By doing this collaboration together, we would have a better solution, the common one for all of us. Cross-border case information sharing, such as Timor and Indonesia. It's good also to learn from them. And for us, the Papua New Guinea and Solomon Islands, especially the Bougainville, and us in the Western region, we also need to share the information, especially in our border region. Thank you.
Thank you. Minister Amaral.
Esteemed delegates, the regional collaboration is indeed instrumental in our collective efforts to eliminate malaria in the Asia-Pacific region. As a neighboring country of Timor-Leste, we recognize the importance and collaboration effectively with Indonesian and other regional partners to achieve this shared objective. To collaborate effectively with our neighboring country, proposal several key strategies. Firstly, develop the framework on cross-border collaboration, and we advocated for the establishment of joint task force or working group comparison representatives with neighbor country to facilitate regular communication, coordination, and joint planning of malaria elimination and preventive activities. This platform would provide opportunity for information sharing, technical assistance, and mutual support, thereby strengthening our collective efforts towards malaria elimination. Both countries have started the cross-border collaboration meeting at national level and provincial Nusa Tenggara Timur and Timur Tengah Selatan on 2022 and 2023. Moreover, through WHO and HLPMA in Indonesia and Timor-Leste has conducted the border assessment on emergency preparedness and response through malaria surveillance. Both countries have come up with conclusion and committed to continue the communication and data sharing as per the finding of the assessment. Turning to the this issue of accountability, neighboring countries are committed to strengthening both national and regional accountability mechanisms to ensure continued commitment to the cause of malaria elimination. At the national level, neighboring countries will establish clear targets, milestones, and indicators for malaria elimination and regularly monitor progress through robust surveillance and data system in ICBS Timor-Leste. Additionally, we support the establishment of regional accountability mechanisms such as peer reviews and mutual assessment to promote transparency, information sharing, and mutual accountability among countries. In conclusion, neighboring countries are fully committed to collaborating with Timor-Leste and Indonesian other regional partners to achieve the shared objective of elimination malaria in the Asia-Pacific region. Through effective regional collaboration, resource mobilization, accountability mechanisms, we believe that together we can overcome the challenges of malaria and create a healthier, most prosperous for all in the future. Thank you.
Dr. Taupo.
Thank you. So for Vanuatu, we have started developing memorandum of understandings with our neighboring Melanesian brothers, especially PNG and Solomon Islands, to see how we strengthen the entire health systems. For malaria particularly, we are trying to look at collaborating with institutions. I see PNG, IMR here, the University of Papua New Guinea is also here, Barnett Institute and other institution, WHO, to see how we can reduce the 14 days doses for Primakin down to 7. And I think that we can roll out to our people. And I think that's one of the areas that we wanted to see and explore in this space. The other thing is the mass screening for G6PD, whether we could do, and then we just roll out, because as I think some of good honorable ministers mentioned, from Solomon Islands mentioned, the supply for G6PD sometimes reaches us very late. So why not we just do a mass screening and then we roll out other treatments. So thank you.
Thank you. And Pak Imran, you've already talked about the cross-border issue, but what else can you tell us?
Yeah, thank you, Leaders Summit. So looking at the successful regional effort like the Greater Mekong Sub-Region that already presented, several strategies can be employed to enhance collaboration and strengthen national and regional accountability in our region. So I want to highlight that pooling resources and coordinating funding mechanism at both national and regional level can maximize the impact of investment in malaria country and elimination. This includes leveraging financial support from international donors, development partners, and private sector stakeholders to complement domestic resources. Joint planning and implementation by neighboring countries is essential in effective resource allocation and filling the coverage gaps in malaria control efforts. And realizing political commitment is vital in the implementation of this initiative, and also realize that advocating for sustained political commitment and increased funding for malaria elimination at both national and regional level should be done. So Indonesia realized that it's important for Indonesia to host the 9th Asian Pacific Leaders Summit of Malaria Elimination in 2025. So we are willingness to have this event hosting in Indonesia. Thank you, Dr.
Thank you, Dr. Imran. We all look forward very much to coming to somewhere in Indonesia next year. So we're not I'd hope to open up questions to the audience, but I'm afraid we don't have any time. So you'll have to catch our ministers and senior officials in the corridor to follow up on any of the wonderful insights they've given us this afternoon. If we go beyond time, Governor Juffa will be very cross because we'll be eating into his time, where we're going to have a very interesting discussion next with the Governor and a number of provincial representatives in Papua New Guinea, very much talking about what we need to do at the province level and both the challenges and the opportunities of decentralization in health. So we're not at the stage of launching a steering committee for cooperation of countries in this part of the region. But the 5 countries represented here today have all wanted to show some commitment to regional cooperation and cross-country cooperation. So right now we're going to launch what's called Eliminating Malaria and Other Vector-Borne Diseases through Enhanced Regional Partnerships, the EDEN initiative. 2 of our ministers, the 2 who aren't here, Minister Pak Budi and Vanuatu Minister, Honourable Taraketu, have already signed this declaration, and our other ministers here today are also going to sign. So please just bear with us while we find a table and a pen for them to be able to sign. And I think we're going to put the initiative text up on the screen, please. While we wait for that, I'd just like to thank our ministers and senior officials very much for their contributions today.
So, Honorable Minister Tom, can we invite you, Minister Phetsouvanh and Minister Amaral to, instead of chairs, do you mind standing to do the signing, or we can bring the chairs? And Pak Imran and Doctor, if you wouldn't mind to come along. So what's on the screen is what's in the folder, so we haven't played any games here, just so you know. Thank you so much.
I just wanted to add my thanks to Lady Murata for facilitating a really great discussion on regional collaboration, so thank you very much. We'll have the signing, and then I believe Dr. Amaral from Timor-Leste will present gifts. Thank you. And then we will break for tea and coffee. Oh, and be back in 15 minutes, I've been instructed to advise. Thank you.